Hello, we're here today to demonstrate the proper technique to take a blood pressure. So first I'm going to show you in a chair. The patient should be sitting with their legs uncrossed and their feet should be supported. In this example, her feet are dangling. So I'm going to add a stool. So you want her feet well supported and you want her upper arm at heart level. So if she happened to have her arm down, you can see that it's a little lower than her heart, so I will ask the patient to move it up so that her upper arm is at heart level. The next thing I'm going to do is demonstrate the proper position in a bed. So you can see here I have the bed in like a semi-Fowler's position. It's I'd say about 50 degrees, 60 degrees elevated so that your patient is in a semi-recumbent position. Again, I'm going to want to uncross her legs so that they're both flat. And I'm going to want to elevate her upper arm so that it's more at the level of her heart with the addition of a pillow. Also, you want to have your patient resting in the bed or sitting for 5 minutes before you do your blood pressure assessment. The first thing I want to do is choose the appropriate equipment to take her blood pressure. In order to choose the appropriately sized cuff, I'm going to use the paper measuring tape and measure the circumference of her upper arm. I'm going to measure the circumference using centimeters. So I'm going to measure the center of her upper arm in centimeters, and I'm going to get my reading there. So I have the centimeters of her arm. Based on that number, I have 4 options of disposable blood pressure cuffs to use the automatic blood pressure machine. As you can see, without even opening any of the cuffs, the range for arm circumference of the blood pressure cuff is clearly displayed on each cuff. So small, the range is 20.5 to 28.5 centimeters, and then you can see easily the range for adult long and adult regular. What you will notice is that the range for the adult and adult long is the same for the arm circumference. The adult long simply has about 5 inches of extra material when you're wrapping it around a patient's arm that it will be secure. You won't have it popping off when you're taking the reading. Okay, so for my patient, her arm circumference has told me to try the adult small. So I'm gonna place this. A really important thing with placement of the blood pressure cuff is this artery indicator. So this shows me right on the cuff that I'm going to place that marker right over her brachial artery. I'm also going to use this cuff to make sure that this size is within the blue range. So I want my index edge, when I wrap it around her arm, is going to fall within the appropriate range. So it's a second way to make sure I'm using the right equipment. So I'm going to line the indicator up with her brachial artery. I'm going to wrap it around, and you can see here that yes, this is the right size cuff for her. So I'm going to go ahead and take her blood pressure with the machine, and her blood pressure is going to be elevated. It's the very next thing I need to do is confirm this reading with a manual cuff. So I'm going to do the same process. I know the circumference of her upper arm. I'm going to find the appropriately sized manual blood pressure cuff. As you can see, it also has the centimeter ranges on the cuff. And they also show you where the artery indicator is. So her artery should fall between those 2 arrows. So I will place this on. I'll take her manual blood pressure. What I then have done is I've confirmed that the 2 readings are within 10 millimeters of mercury from each other, which confirms to me that my automatic blood pressure machine is working and it's appropriate and calibrated. So let me demonstrate, because you need to also choose the appropriate equipment to take a blood pressure on the forearm. The forearm is a different circumference than the upper arm, so could actually cause me to need to choose a different size cuff. So you follow the same method. You're going to use centimeters. You're going to measure the middle of the center of her forearm, and her forearm is actually 8 centimeters smaller than the circumference of her upper arm. So in a lot of patients, that could drop them down to a different size cuff. So you need to use the appropriately sized cuff for the forearm, and you need to invert the cuff when you're putting it on the forearm. The reason for that is you're going to still be lining up and including the brachial artery. So I take it, I've now inverted it. I still have my artery marker. I'm going to line it up with her brachial artery. I'm going to wrap it around and make sure, confirm again that it's within the range, and then now I can take a blood pressure on her forearm. Thank you. Yes, thank you.